welcome to Wellness Wednesday. I'm Dr. Jessica, the naturopathic doctor here at the Coach House. Pregnancy is something that we treat throughout the clinic with varied practitioners. There's lots of physiological changes that happen, and all of our practitioners, physiotherapy, chiropractic, naturopathic, and registered massage therapy can help you through. So today we have registered massage therapist Elsie Kelly here to answer a few questions about how we adjust during pregnancy and getting a massage. So Elsie, you've heard a couple of times that you may not need to get a massage during first trimester, or that you shouldn't. Can you touch upon that?
So usually in your first trimester, a lot of women get a little bit hesitant about getting a massage. And honestly, that's not the case. If you have a healthy pregnancy and you're cleared for any medical conditions from your practitioner, or such as your family doctor or your midwife, you can continue to do massage therapy throughout your entire pregnancy. Usually with your first trimester, it's more of just regular aches and pains that you have been experienced prior to your pregnancy, and we just kind of touch upon those areas. Obviously, we wouldn't be touching anything around the tummy just for safety reasons. You want to get the baby going and without any interruptions like that. So yeah, you can just continue to get regular massages, and we just work other parts of the body, and we just do more of a relaxation as opposed to a deeper tissue.
Great.
Yeah.
So you said with first trimester, it tends to be kind of your similar aches and pains. What would you normally see in second trimester?
Second trimester, you're getting a little bigger, the tummy's growing, so you'll get more mid-back aches and pains. Sometimes head, neck, and shoulders will continue. Depending on movement, once you're past like 24 weeks or so, you might get a little bit more movement, so a little bit more tightness in around the pelvis. And sometimes you get a little bit of glute tension and around the hips as well. And once again, we can still work those areas, but now we're just mindful of working around the sacrum very deeply, or not as long, obviously, but we can still work the glutes and the legs just to get some circulation going. We'll just change the direction of how we're massaging your body. It's not going to be long strokes towards the heart, obviously, because you have more blood flowing. We don't want to increase that circulation if you are having issues with blood pressure as well. But usually we're still working the areas that are bothering you, and we just take it to what you're comfortable with.
And then into third trimester as well?
Third trimester, that's the good stuff. That's when the tummy's really out, the pelvis is rotated forward, so we can really get a little bit deeper into the glutes, the hips area. I love third trimester also because at this point, if you have a child, like your baby is head down, you're going to get little feet kicking you in the ribs or even down in the bladder, so we can start really doing a nice belly massage for you. And it's the baby's first massage as well, so they actually respond to it very quite nicely, actually. But especially if you're having trouble breathing, we can really work the rib cage area, try to loosen the tension up for you there. And it actually feels really nice and relaxing.
And now, correct me if I'm wrong, but getting closer to labor and delivery, massage can actually help with that as well, can't it?
Yes, we can start working certain pressure points, usually closer to your due date, maybe like a week or so before. Nothing earlier than that, because we don't want to induce labor for you. That's not a good thing, and unless you want it, obviously. But we have pressure points around the ankles that we can actually work on. Yeah, it's just preference. If you want to get things going, we can definitely do that for you. But then, yeah, we're still working the same areas. You can even get massage on your due date. It actually helps with your contractions and your labor, just to get things moving along for you. Yeah.
Now, there is some concern with most massage ends up being face down. So as that tummy grows, how do you accommodate for that?
So we do have a couple positions that we can offer for the mom. We do have a pregnancy pillow here at the Coach House where you can go face down. A lot of women do like to keep doing the same position. I do recommend once you're past about 4, maybe 5 months, we start doing a side lying position with lots of pillows. You get more into a fetal position, you get really comfy and cozy. I prefer to treat that way, and depending on how large you get in the front, it's whatever your comfortable level, your comfort level is, but we can do both positions, and you can still get every part done. Obviously, if you're on your side, we'll just switch sides so we can work the other side properly for you.
Awesome. Okay, so now we'll move into a treatment room and we'll actually have Elsie demo how we would use either the pregnancy pillow or using a sideline position.
Okay, we are now inside a treatment room and I'm going to show you how to use the pregnancy pillowing system. So it comes with four parts. There is a separate base cradle that we use. It does lift you up a little bit. Now this section is for the breast and the upper part of the tummy, and then this is for the lower half. Now we would measure, kind of take a quick measure to see how further along you are during your pregnancy. Obviously if you're a little bit bigger, and we can space the cushions out for you, okay? So we have Melanie here. She's going to demonstrate how to position yourself on the table. And then this way we can still go, you can still go comfortably face down, and you can still work all the areas of the back, the hips, and the legs. Now I'm going to show you how you can also use the same system using sideline position. So she would just lower herself down a little bit. That way the arm goes in between the spaces. You are on your side. You do have your head supported. And then we would change this so it goes in between your legs to give your pelvis a more, like a better alignment. If it's a little too high, then we could always adjust for you. So there you go. We can get everything worked on. You can still working head, neck, and shoulders, arms, back, and then to work on the other side, I would just get the person to switch to the other side. Okay, so now I'm going to show you how to lie in the sideline position using just regular pillows. So I've already given Melanie a head pillow just to support her head. So I like doing this position only because once you are further along in your pregnancy, it will you will get more tension in your low back and the mid back. So I like to do this position because then you're in a more comfortable position, and you can cozy up with the rest of the pillows. So I'm just gonna put this pillow in between her knees just to support her pelvis. If I find the pillow is a little too thin, I could always place another one, but she seems to be okay in proper alignment here. Now I will give her another pillow just to hug. That way she's a little bit more cozier. She can relax her upper arm, and she can, you know, kind of hug herself there in a more comfortable position. If she is on her back, so this is how I would treat regular, you know, head, neck, and shoulders, back. I can still get into the glute area, work the top of, or the lateral side of her left leg. And, you know, just we can combine, you know, go through regular techniques, working on all the tension that she has throughout her pregnancy. Now, I will also show you how I can treat full head, neck, and shoulders and the tummy massage when you're on your back. So I'm just going to remove this pillow, remove this one, and if Melanie, if I can just get you to turn onto your back, I would obviously help you here so you don't fall off the table. How is this head pillow for you?
Good.
Okay. If it is too low for you, I could always prop you with another pillow. So once again, I will place a pillow underneath your knees just to support your low back. And I can give you a little bit of bolster. Usually when you are further along in your pregnancy, Melanie is close to 8 months, I can give you a little bolster just to lift the right side of the hip. How's that feeling?
Good.
Is that all right? So from here, obviously you will have a sheet and a blanket on top. But then here, I can still work your head, neck, and shoulders. Really work the pec muscles since that area seems to get a little bit more tighter. Work the arms. And if you are comfortable getting a tummy massage, we can do it over the sheet. Or if you'd like, I could use lotion. I would give you a towel just to cover the breasts. So I will just quickly demonstrate. Pretend she has the sheet here. Obviously, you would do that, not me. I would undrape, and then we can really work the tummy, work the rib cage, just to decrease some of the pressure for you. Okay, so yeah, you're still getting a regular massage. We're just doing areas that are more concerning to you throughout your pregnancy.
So thank you to Elsie for giving us a demo, and Melanie for letting us borrow her belly. We hope you enjoyed this video. Be sure to follow us on social media and check out our blog for more information on all of the services that we can provide you if you're pregnant here at the Coach House. Thanks for watching.